Hi, I'm Jason Edwards, and this is Doc Discussions, Episode 3. For a disclaimer, I am not your doctor, and this is general medical advice, and so talk to your independent physician or your own physician before you implement any medical care. My guest today is a board-certified allergist and immunologist. He did his training at the University of Missouri in Kansas City and residency at Indiana University in downtown Indianapolis. And then he did his fellowship training in Chicago at Rush University. This is Dr. Hassan Ahmad. How you doing, sir?
Doing very good. Thank you for having me.
Your time here at St. Luke's, how long have you been here in town?
Oh, I've been with St. Luke's, and I moved back to St. Louis about last summer, and I joined St. Luke's last August, and it's been going very well so far.
When I think of allergy and immunology, now, of course, I'm a radiation oncologist, so it's not a ton of overlap between our fields, but the first question that came to my mind is, what's going on with the peanut allergies? When I was a kid, it was like not a thing as far as I remember, and now it's like very prevalent.
Well, food allergies, particularly in the Western, hemisphere, and the Western, particularly in the United States, they're on the rise. And I think compared to when we were children, there's more individuals now who have food allergies compared to 30 or 40 years ago even. And so that continues to be a big problem as it continues to rise in school-age children, and there's more precautions that are put in place in school for this.
Do they know what the underlying mechanism is for the increase in prevalence?
Yeah. Well, I think that's a really good question and something that they're continuing to research, but I think that it's probably a multifactorial kind of phenomenon, so to speak. I think that part of it probably has to do with the Western diet that is somehow a trigger. Part of it has to do with the Western environment, which is somehow different, because if you look at Asia and Japan, et cetera, these kind of countries over there, they don't seem to have as many food allergies, particularly in children, as we do.
Yeah.
So there's something in the environment here that's triggering the development of these kind of allergies in children.
One explanation may be that you said the Western diet, and that you have less fiber in the diet, and so maybe you have a not as strong of a mucosal barrier in the gut. That leads to potentially leaky gut syndrome, and that you have some antigens seeping into the bloodstream. Is that kind of the idea?
I think that is part of the idea. I think that the diet certainly, and perhaps the fiber content, I think has something to do with that. I think that there's something to do with the microbiome as well, and there's a lot more study these days in the microbiome and the good bacteria we have in our gut compared to the bad bacteria, so to speak. And if this bacteria seems to get out of balance in any way, then it may lead to development of certain conditions or diseases, and one of them being food allergy. I think the other thing that I mentioned, to kind of circling back to the question about why are food allergies on the rise compared to other parts of the world, and I think that there's a lot of data now that shows that breastfeeding in particular seems to be at least somewhat protective for an infant to develop these kind of allergies. And in some cultures and other places in the world, they seem to be more focused on exclusive breastfeeding as opposed to other places, and so that might play a role as well.
And this actually happens to be very topical right now because we have this shortage of baby formula.
Certainly, breastfeeding has a lot of health benefits for the infant, and one of them is certainly the antibodies, which help prevent infections. But there seems to be some other protective effects of the breast milk to try to prevent atopic conditions developing in infants, such as food allergies, eczema, later on even perhaps decreased asthma incidence in these children as well. And I think that that's a benefit that I can't quite quantify or tell you exactly why, but it seems to be pretty clear in the data. And I think that there definitely is a push, so to speak, to try to encourage breastfeeding, though obviously I think that in certain situations, formula, if it's necessary, should absolutely still be used, certainly.
And again, I'm here with Dr. Hassan Ahmad, an allergist and immunologist. Seasonal allergies, which are probably more prominent in St. Louis than I think most places. Is that due to just plant diversity, or what's the underlying mechanism?
And so I think that there's a lot of reasons for that, and I think one of them has to do perhaps with the expanding pollen season, because there's some data now showing that in the spring, after winter breaks, that the pollens are appearing earlier and earlier each year.
Okay.
And then on the opposite end, in the fall, when it's supposed to be getting cold, that the pollens are going later and later into September and even October, when previously the season was a little bit shorter. And so I think that's part of the reason why we're seeing these kind of expanded nasal allergies, is because the pollen season's getting longer.
And is there one plant that kind of dominates the pollen, or is it just
well, I think it depends that time of year, and certainly in the fall, August, September, October, the one plant that really dominates it is ragweed.
Is that right?
That usually pollinates in the fall. And then on the opposite end of that spectrum in the spring, once winter breaks, you're looking at the various tree pollens, which can be, the big players that we might have are birch, oak, and cedar trees.
Is that right?
Yeah.
Yeah. And that kind of, I guess, being at the crossroads of two major rivers, there's plenty of plant life
There's
around.
there's plenty of diverse kind of wildlife and plant life here, and the pollens that come with it. And the other thing that people are sometimes surprised about is, I tell an individual after an allergy test, for example, that they're allergic to birch trees and oak trees, and then they're relieved because, I don't have any of those in my yard necessarily. Well, the thing to keep in mind is that pollen doesn't just travel from your neighbor, but it can actually travel for miles. Like, there's studies showing that the pollens can travel even 70, 80 miles.
Is that right?
And so even if you don't have them necessarily even in your yard or neighborhood, you might still be exposed to it if it's even in the St. Louis area, certainly. So,
is your practice, is it more adults or more children?
Well, it's a mixture of both. I'm certified in internal medicine, pediatrics, as well as allergy, and so I'd like to have my practice as close to 50-50 as possible. And since I joined St. Luke's, I'm trying to build up both kind of halves of that base. And so I'm accepting patients of all ages, and I hope eventually that my practice will be kind of right at that 50-50 mark.
Yeah. We'll never be said. It'll be a little bit better.
It'll be a little bit unbalanced perhaps, but I like to see a good mix of patients of all ages.
Yeah. I think that makes a medical practice nice to have kind of some variety in it.
I think it does. It breaks up kind of the routine day-to-day if you're seeing different kinds of ages and different kinds of conditions. And the nice thing about an allergist is that I'm not necessarily seeing the same thing every single case, is that there's a lot of different conditions I can take care of, whether it's food allergies, nasal allergies. I can take care of asthma as well, eczema, kind of skin rashes. And so I kind of have my plate full with a lot of different kinds of conditions, and then mix in the different kind of ages I can see as well, and then that makes for a pretty interesting day usually.
Very good. And I do think that, there's some value in just doing one thing and one thing only, but sometimes doing a couple of different things actually makes you better at one thing. When you're doing thing A a lot, you learn some things that help you with something that's a little bit different.
Yeah, I think so, because a lot of these conditions can have a lot of overlap between them, and if you have some experience from treating related conditions, and that can help make you a better physician when you try to treat other things as well.
Very much agree. I'm talking to Dr. Hassan Ahmad, an allergist and immunologist here at St. Luke's Hospital, and this is Doc Discussions. Is there anything else that's going on in the field of allergy and immunology that you think is very interesting or new and happening that you'd like to share?
Well, I think that some of the new things that are coming out are, some of the new drugs that are available, biologic therapies, and so some of the conditions I treat are severe asthma as well as severe eczema, and there's some new biologic medications for these. And so particularly in the asthma realm, there's a new medication called Tezspire, which can help treat patients with severe asthma that maybe they didn't qualify for some of the other medications.
And what do you mean by biological?
Yeah. And so biologic is actually an injection therapy, depending on which one you would get. It's either once every 2 weeks, once a month, or once every 2 months. And it kind of helps calm down your immune system if your asthma might be driven by kind of overactive immune system on the inside of your body.
Okay.
And this has been, over the past, I think, 10 or so years, really revolutionary in how we treat severe asthma, because there's more options now beyond just the inhalers. Sometimes the inhalers aren't quite good enough for everybody. You need to move to something more advanced, and these biologic therapies are a really good option.
You said calms down the immune system. A weird thing about the body is there's kind of things that are gas pedals and things that are brakes. And whether it's constriction or dilation of an artery, there's always these factors that are contending with each other that are trying to make the immune system or go this way or that way, or make blood vessels dilate or constrict, and they're always kind of opposed to each other, but they get out of balance sometimes. And these drugs are kind of targeting either to stop the gas pedal or to
that's
push on the brake.
Exactly it. And I think that one of the big asthma subsets I would describe is eosinophilic asthma. So eosinophils is one of kind of the white blood cells we have in our body, and if you have a very high allergic tendency, these allergy cells will go up, and they can help drive asthma. And something that some of these biologic medicines try to do is decrease the number of eosinophils you have, or at the very least calm them down, so that they're not flaring someone's asthma all the time.
That's very interesting.
And so it kind of goes a step beyond treatment with just the inhaled steroid inhalers to try to, like a more advanced kind of therapy, and it can really help. and it's really helped many patients now.
That's a big
Yeah.
deal. You know, before I was a physician, I just thought, well, asthma is, you know, every once in a while you get short of air.
Yeah.
But I've seen, and I know you have, seen people with severe asthmatic reactions, and
Yeah.
and it can be life or death. I mean, it can be shocking sometimes how bad that can get.
It can be, yeah, and especially a lot of individuals are unfortunately, you know, they're going through very severe illnesses and they're ending up getting treated with steroids every few weeks, every few months, or if it's severe enough, going to the emergency department every few months. And those are kind of the individuals that really benefit from these advanced kind of therapies.
And the advanced therapies, I would assume they have less side effects as opposed to steroids, which kind of have broad side effects. Throughout
Yeah,
the body.
you know, certainly compared to oral steroids, which have, you know, many side effects on your bones, your heart, your blood sugar. The inhaled steroids have somewhat less side effects than that, and
Okay.
most of the biologics are pretty well tolerated without many side effects, though depending on the option you choose, each one might have its own small side effect profile we need to be aware of.
Yeah.
Yeah.
Very good. Dr. Ahmad, thank you so much for your time.
Yeah, thank you. It's so great to be here.
Very much appreciate you being subjected to this, and I had a good time talking to you.
Yeah, thank you. I really enjoyed it.
Yep, very good. All right, that's it for this episode of Doc Discussions. Thank you so much.